If you are serious about saving your kidneys and avoiding chronic kidney disease, you need to know that eating the wrong foods can silently destroy your kidneys without you even feeling it until it is almost too late. In the United States, where kidney failure rates are skyrocketing, healthcare professionals warn that diet is often the hidden culprit behind devastating kidney issues that are often diagnosed when it's far too late. Many families across Canada, Australia, and the United Kingdom are watching their loved ones go from healthy to dialysis patients because nobody warned them early enough about what foods can silently poison the kidneys. The first food that must be eliminated is processed meats, including hot dogs, bacon, sausage, and deli meats that are popular across the United States and Canada. These meats are loaded with sodium, nitrates, and phosphates, which are used to preserve the meat but cause direct inflammation and scarring in the delicate filtering structures of your kidneys. Studies from American healthcare institutions have confirmed that consuming processed meats leads to faster decline in kidney function and can double your risk of needing dialysis if you already have early signs of kidney damage. Imagine sitting in a dialysis clinic for 4 hours a day, 3 days a week, because of foods you could have easily cut out. Many people in the United States who ignored these warnings now wish someone had been brutally honest with them earlier. Second on the list are canned soups and canned vegetables that are packed with high amounts of sodium to preserve their shelf life. In the United States, where convenience foods dominate the grocery stores, canned goods are a household staple, but they are extremely dangerous for kidney health. Excess sodium intake makes the kidneys work overtime, leading to hypertension, which is the second leading cause of kidney failure after diabetes, according to United States healthcare data. Even in Australia and the United Kingdom, where dietary guidelines emphasize fresh food, people are falling into the trap of believing that canned vegetables are a healthy alternative. Unless labeled low sodium, canned foods are stealthily damaging your kidneys every time you eat them, building pressure inside your tiny renal arteries until one day they burst. The third category of kidney-destroying foods is soda, especially dark colas that are loaded with phosphoric acid. In the United States, it's almost culturally normal to drink soda with every meal, but this habit is slashing kidney function without warning signs. Research from American universities shows that individuals who consume 2 or more colas per day have a significantly higher risk of developing chronic kidney disease compared to those who avoid soda. Phosphoric acid not only disrupts your body's mineral balance, but also leads to an overload of phosphorus, forcing the kidneys to work dangerously hard. Many patients in Canada who now suffer from end-stage renal disease recall daily soda habits that felt harmless at the time but ended up costing them their freedom, their energy, and in many cases, their lives. Fourth, avoid fast food meals that are loaded with excessive sodium, unhealthy fats, and chemical additives. Every time you drive through your favorite fast food chain in the United States or grab a meal deal in Australia, you could be swallowing a cocktail of toxins that your kidneys must filter out. Over time, the burden is too much, and the delicate nephrons inside your kidneys collapse, leaving behind scar tissue that cannot be repaired. Healthcare providers across Canada and the United Kingdom are now urgently warning that fast food consumption is linked directly to the surge in early-onset kidney disease, even in people in their 20s and 30s. Imagine having to give up your dreams, your career, and your independence just because fast food felt convenient for a few years? Fifth on the list is frozen meals and TV dinners, heavily consumed across the United States because of their convenience and low cost. These meals often contain astronomical levels of sodium, phosphorus additives, and preservatives that are devastating for kidneys. United States healthcare reports show that patients who rely heavily on frozen meals have worse blood pressure, control, higher proteinuria, protein in urine, and much faster progression to end-stage renal failure. Many Canadians, too, remember eating frozen meals daily during busy work weeks, and later regretting how it contributed to their irreversible kidney decline. Healthcare practitioners in Australia are now actively campaigning to limit frozen meal consumption due to the alarming rise in preventable kidney disease cases. Sixth, cut out packaged snack foods like chips, crackers, and salted nuts that flood the grocery stores in the United States and Canada. These snacks are loaded with salt, unhealthy oils, and artificial flavorings that directly injure the kidneys over time. Even healthy-sounding versions in Australia and the United Kingdom are often misleading because they still contain too much sodium for anyone concerned about kidney health. Chronic salt overload causes structural damage inside the kidneys, slowly transforming healthy kidney tissue into fibrotic, useless scar tissue. Patients often report that by the time they notice symptoms like swelling, fatigue, and changes in urination, more than 70% of their kidney function was already lost. By then, reversing the damage was impossible, and dialysis or kidney transplant became the only options. 7th, avoid bakery goods such as cakes, cookies, and pastries that are a huge part of American and Canadian diets. These foods are not only loaded with refined sugars but also saturated fats and trans fats, which accelerate vascular damage, including inside the kidneys. Elevated blood sugar levels from a diet high in bakery goods leads to diabetic nephropathy, the #1 cause of kidney failure in the United States, according to the National Institute of Diabetes and Digestive and Kidney Diseases. In Australia, healthcare experts are warning that processed sugars combined with fats are a catastrophic mix for kidneys because they create oxidative stress, inflammation, and direct endothelial injury. In the United Kingdom, many kidney patients looking back on their lifestyles realize they consumed high-sugar bakery items almost daily without knowing they were setting themselves up for chronic illness and life-threatening complications. 8th, on the list is dairy products, especially full-fat cheese and whole milk, which are extremely popular in the United States and Canada, but are dangerous when overconsumed by individuals with kidney vulnerability. Dairy products are rich in phosphorus, potassium, and saturated fats, all of which must be tightly regulated once kidney function begins to decline. Excess phosphorus accelerates bone mineral disorders common in kidney disease, leading to fragile bones and cardiovascular disease, two major killers of kidney patients in Australia and the United Kingdom. Many patients report feeling shocked when their doctor explained that the healthy milk and cheese they grew up on could now speed up their decline towards dialysis unless they drastically change their diet. In fact, American healthcare providers now often recommend plant-based alternatives to reduce this burden. 9th, avoid restaurant foods, particularly from sit-down restaurants, because even meals that seem healthy on the menu in the United States are often packed with hidden sodium and unhealthy fats. When researchers in the United Kingdom analyzed restaurant foods, they found that a single entree could contain more than double the recommended daily sodium limit for kidney patients. Canada's healthcare system has similarly issued warnings about restaurant meals posing hidden dangers to individuals with early kidney disease. In Australia, it's becoming common advice for kidney patients to cook most meals at home because restaurant meals are so often overloaded with kidney-harming ingredients that even careful menu choices are not safe enough. People often feel betrayed by the food industry after realizing that their favorite healthy restaurant meals were actually contributing to their kidney failure. 10th, and equally important, avoid instant noodles and ramen, which are cheap, convenient, and incredibly popular in the United States, especially among college students and busy workers. Instant noodles are packed with sodium, preservatives, and chemical additives that stress the kidneys beyond safe levels. Multiple studies in American healthcare journals have shown that regular consumption of instant noodles significantly increases the risk of hypertension and metabolic syndrome, both of which are leading risk factors for kidney failure. In Canada and Australia, public health campaigns are warning against the heavy use of instant noodles, particularly among young adults, to curb the rising tide of preventable kidney disease. Patients often describe how they thought instant noodles were harmless until they found themselves facing a lifetime tied to a dialysis machine, wishing they had been told sooner how dangerous their convenience-based diet really was. When you realize how many common foods can be absolutely devastating for your kidneys, it's easy to feel overwhelmed, especially living in countries like the United States, Canada, Australia, and the United Kingdom, where processed and convenience foods dominate almost every grocery aisle. Across the United States, healthcare providers are seeing younger and younger patients being diagnosed with kidney disease, many of whom never even thought about kidney health before their diagnosis. One American teenager who loved soda and instant noodles ended up in critical care with severe kidney damage at just 19 years old, spending months in a hospital bed instead of enjoying college life, all because of habits that felt normal growing up. It's terrifying to understand that the damage from these foods is often silent. There are no warning lights flashing in your body when your kidneys are under attack. In fact, kidneys are so efficient that by the time you experience symptoms like swelling in your legs, puffy eyes, changes in urination, or extreme fatigue, you could have already lost up to 80% of your kidney function without knowing it. Across Canada and Australia, nephrologists are warning that by the time symptoms are visible, kidney disease is often irreversible, locking patients into a lifetime dependency on dialysis machines or forcing them into a desperate search for a Kidney donor. In the United States, dialysis is now a booming industry, with massive profits being made off the suffering of millions of Americans who never understood how their everyday food choices could lead them to this point. Imagine spending 4 hours a session, 3 times a week, tied to a machine just to survive. Think about missing family events, missing vacations, missing milestones, all because the kidneys that silently served you for years finally gave out after decades of abuse from the wrong foods. Patients often talk about the deep regret they feel, wishing someone had told them clearly how to protect their kidneys before it was too late. Across the United Kingdom and Canada, patient advocacy groups are pushing for stronger education about kidney health because the reality is that most kidney disease is preventable through diet and lifestyle changes. In Australia, where cases of kidney disease are sharply rising, public health campaigns are now trying to fight back against the fast food culture that has gripped society. Still, despite all these efforts, the food environment in the United States remains one of the most dangerous for kidneys anywhere in the developed world. Processed foods, high-sugar products, salty snacks, and chemical-laden meals are everywhere, making it almost impossible to avoid unless you are actively and aggressively protecting yourself. Many patients in the United States report feeling betrayed by the healthcare system because warnings about diet often come too late. After years of silently developing high blood pressure and insulin resistance from unhealthy eating, they sit in a doctor's office and hear the words chronic kidney disease for the first time, often in shock, terrified, and confused. They think back to all the fast food, soda, canned soups, and frozen meals they relied on because of busy schedules, family obligations, or financial stress, and the anger and sadness they feel is overwhelming. One American mother described sobbing uncontrollably when told she would need a kidney transplant, blaming herself for not knowing how dangerous her typical diet had been. Healthcare providers across Australia and the United Kingdom often emphasize that it's not just about cutting out the obviously bad foods. It's about fundamentally rethinking food as medicine. In the United States, a powerful shift needs to happen where food education becomes a central part of healthcare, not an afterthought. Doctors are now realizing that patients need to be taught early on that their kidneys are at risk from everyday foods that look completely harmless on the surface, but are silently toxic when consumed over years. For example, sodium doesn't just come from the salt shaker on your table. In the United States, about 70% of sodium intake comes from processed and prepared foods before it even reaches your plate. Even healthy-looking sandwiches, soups, or salads from popular American chains can contain shocking amounts of sodium, putting enormous strain on your kidneys without you realizing it. Canadian studies have shown that when people start cooking from scratch and avoiding processed foods, their kidney function stabilizes and sometimes even improves, delaying the need for dialysis by years. In Australia, kidney health experts are urgently warning people to read food labels because phosphorus additives are now hidden in so many processed foods like frozen meals, fast food, bakery items, and even beverages. In the United States, phosphorus additives are not always clearly labeled, making it extremely difficult for consumers to know what they're eating unless they research every ingredient. Phosphorus causes mineral imbalances that damage blood vessels and the bones, dramatically speeding up kidney decline. American patients often realize far too late that their favorite foods were quietly flooding their bodies with phosphorus for years. The emotional impact of being diagnosed with kidney disease cannot be overstated. Across the United States and Canada, support groups are filled with people who describe feelings of fear, depression, helplessness, and grief over the loss of their health. Many recount how their diagnosis stole their dreams. Careers were cut short, travel plans abandoned, family plans shattered. In the United Kingdom, patients often share heartbreaking stories of needing to choose between work and dialysis, between family time and hospital time, between living and merely surviving. In Australia, too many young people are now facing choices their parents never had to make, like whether to start dialysis at 25 or try to hold out for a transplant. For people living in the United States, the financial burden is another brutal reality. Dialysis treatment can cost hundreds of thousands of dollars per year, often bankrupting families despite having insurance. Across Canada and Australia, while healthcare systems cover more costs, the personal toll in time, energy, and emotional well-being is just as devastating. Imagine spending 10, 20, 30 years tied to a machine because of foods you didn't even know were harming you. This is the stark reality for millions. Critically thinking about how food companies market products is essential to survival. Now, in the United States, food advertisements show smiling families enjoying processed foods, fast food, soda, and snacks, creating a fantasy that these foods are harmless and even part of a happy life. In reality, those very foods are sending millions toward kidney failure every year. Healthcare experts across Australia and the United Kingdom are now calling for warning labels on foods high in sodium, sugar, and phosphorus, similar to the warning labels on cigarettes, because the dangers are equally life-threatening. Every single choice you make at the grocery store, at a restaurant, at a coffee shop matters. Choosing to avoid processed meats, canned foods, sodas, fast foods, frozen meals, packaged snacks, bakery goods, full-fat dairy, restaurant foods, and instant noodles could save your kidneys and your future. It's a harsh reality that many the United States, Canada, Australia, and the United Kingdom are only realizing after facing life-altering diagnoses. Patients often say they wish someone had scared them into changing their diets earlier. They wish someone had shown them the dialysis clinics, the endless medical appointments, the restrictive renal diets, the countless medications, and the sheer exhaustion that becomes daily life when kidney function is lost. They wish someone had told them bluntly, clearly, with no sugarcoating, that the foods they loved were quietly killing them.